So all that we're doing is nice, pretty much nice and relaxing moves. So we're just doing the same 3 effleurages that we open the leg with. We're closing with 3 effleurages. Okay, so if you wanted to make that a bit more of a remedial deep tissue, then you might want to go, or sports, you might want to go a bit more into the calf and just spend a bit more time. Find some pressure points, go a little bit deeper. So take a nice deep breath. Just check out with your person. If you've gone too deep, get them to take an extra breath. Some people can have very tight calves, so sometimes that's why people don't like getting too much on their legs, because it can be painful, or they've had a painful massage. So just find, but if somebody's more into sports and that, often they do really enjoy their calves being done. You may just find little tight spots in through the muscle. Nice deep breath. So I'm observing her breath. That's giving me an indication of what's going on in the muscle as well, how she's perceiving the sensations. So it's like a biofeedback. So you can do a bit of that. And we're going to lift the leg. If the person tends to activate their muscles, and you might have to just remind them just to relax it. We're dropping the foot onto the shoulder, then interlocking the hands, and just a little squeezing. Actually, this is a good way too, if people have really tight calves and they don't like the pressure, directly down here, is to actually lift the leg up and squeeze the muscle away. And then to bring the fingers through, like rake the fingers through the muscle. So that's not as intense. And it's a great way, especially for sports as well, to get the blood flushing through the muscles, get the lactic acid through and out. As long as a person is breathing, that oxygen from the breath will help neutralize the lactic acid in the muscles. And then if somebody has a tight Achilles, always nice to do a little bit up either side of the Achilles. And while we're here, we could go back up into the back of the hamstring again. Shortening those muscles a little bit, so it's a little bit different for the actual muscles. You can do a little bit more on the IT band by just taking the foot over. Somebody said they had a tight IT band, be a bit more Pacific work on there. And also getting around the hip is a good way in this position. So you feel that bony protrusion, the greater trochanter, and we're going to drop inside that and the hip. So it's a good little indication. So if you bring the foot out and in, you'll feel the bone move under your hand. It just gives you a little feeling. And then kind of play around with those muscles. If you close your eyes, you'll be able to feel deeper and just to circulate around there. So the piriformis connects from the greater trochanter, the inside, into the sacral area. So up here, so that can be tight on people. So you can sink in around the hip for that, check in with your person. So this is more, again, people are going to be asking generally for remedial or sports or therapeutic. They're wanting something a bit more Pacific, deep tissue. Deep tissue is really just the pressure. So when we're doing these ones, it's a bit more remedial, it's a bit more therapeutic, a bit more Pacific. We'll help and release specific muscles that are causing our client some challenges, discomfort. It's nice for everybody to get these, really, just to get some movement through all those different muscles. But again, if somebody can't relax when you're in here and they keep holding their muscle because they're just not kind of used to getting massage, it could be a bit much for some people. So that's fine. You just release. So you just find out what people, what kind of experiences they've had, or what they're looking for. And if you honor that, then you should do very well. Okay, so that's pretty much what we're going to do on the legs. So again, if you've done a bit of deep tissue, it is nice. You don't have to. If somebody's really doing a deep tissue massage or a sports massage, they're not necessarily going to do effleurage. Effleurage is more that soothing, relaxing stroke. And the holistic intuitive massage training is intended to be able to give you the option so you can do a fusion of relaxation and deeper tissue and really adapt to what the person is looking for, and be to bring in different elements of these different styles of massage. Because usually what people actually require is a mixture rather than one specific one. Sometimes if it's just all deep tissue, if you just go for deep tissue, they're just going to go hard out the whole way through, and it could actually be quite painful, and our client would potentially stop breathing. She's still going a little bit there, but it could just be hard out. For some people, that's what deep tissue means. It just means hard out, pressure the whole way through, and it may be very uncomfortable for the person. It may be very painful. So what I share is that it doesn't have to be. And so just finding the right amount of pressure for a person, that they can keep that deep breathing, so that the body, so you're working with the intelligence of the body, which is the breath, switching on the parasympathetic nervous system, and then the body's letting the muscles know that it's safe to let go and release. So it's not turned into a battle between the therapist putting on pressure and the person holding their breath, pushing you out. Okay, and then we just finish on the feet. Just again, back of the hand, just a couple of strokes on the feet, 3 or 4. And that's quite nice. And then we'll come into more of our deeper tissue. Well, also, this isn't so much deeper tissue, but it's just a way of flushing the tissues. And definitely is a great inclusion for sports massage and remedial therapeutic. Somebody specifically asked for the legs, interested in getting the legs massaged. Maybe even has shin splints. You can really work with shin splints behind the bone. Just dropping in. That can be quite painful for people if they have shin splints. And then flushing through the calf muscle, the gastrocnemius. And getting up into the Achilles as well. Quite nice in this one. Okay, and then I can move that foot to get into the IT band, up the side, and then around the hip a little bit more. So I'm taking the foot out towards me, and then inward. So just kind of opening up, broadening those muscles. So bring it in, they tighten up a little bit, but also kind of adds a bit more pressure. So I can drop into some pressure points. So I'll open it up so I can get a bit more behind the greater trochanter in towards the hip joint. And you may just feel some area feels like the right place to stop, add a bit of pressure. and take it back down. You do another 1 or 3 effleurages, but we'll leave it there as more of a deep tissue. Shows of 3 effleurages. Okay, so now that we've done the legs, you can either walk back up or just make your way back up to the back, and then we'll finish with 3 breaths. So taking a nice deep breath. So I've got one hand behind the heart center, one hand behind the sacrum. Feels nice and safe. So you don't want to put the hand under the on the lower back, just because, yeah, I don't advise putting the pressure on the lower back, but it feels nice and safe and comforting to put it on the sacrum and the back of the heart center. Okay, and to turn her over, I'm going to go over the other side so I can be more discreet. I'm going to hold the drape with my thighs, and then I'm going to lift up on the other side. So first I'm going to, Pavi, we're going to move now. You're going to turn towards this side. I'm on this shoulder. So if you turn towards me onto your back and scoot down the table, please. Lovely jubbly. Good, good, good. And then we get your eyes covered. So I'm using my facial drape to cover the eyes. I'm going to lift the head and bring a little cushioning into the head. And then just add in a little, bring your hands up the person's neck and just give a little tug under the occiput, just to make sure it's a nice long neck. So some people require the pillow, some people don't, depends on what's going on. Some people require more height. So what we're looking for is a nice long elongated neck. And then you can push the shoulders away from the ears. And then as we're changing the bolster underneath, we've got pillows. I'm going to bend my knees, lift her legs, and then drop it down. So my intention is that my person doesn't have to engage their core and lift their legs, but if the legs are too heavy, you can always ask them to bend their knees. I'm sure they'll be more than happy. But ideally, I'm encouraging my clients to just really know that they don't have to think of anything or do anything, and that they can just let all that go for the time that they have on the table. Okay, so I'm going to start on the right leg, my client's right leg. Okay, so once I've got my 3 effleurages, to make it a little bit go deeper tissue or more Pacific, you can take your thumbs up along the muscle, and then maybe some areas that you want to sink in a little bit more. You may find some trigger points. And if there is some mega tightness, you can always tune in with your client and work with their breath, add the pressure on when they are on the exhale. And also, if you're doing something a bit more sporty, you want to rake through that muscle and flush. It's good for everybody, but especially people who do sports as well, they really enjoy that because that lactic acid that builds up, and just to get the oxygen, loosen up the muscle fibers. Okay, so we're going to close the 3 effleurages. So the other thing I'll actually share about the leg, if you want to do a bit more, especially if you had a bigger person, rugby player or something like that, just a bigger person, instead of using your hands, you could use your forearms and actually use your forearms to drop into the quads, cover that leg. So that would really save your hands if you happen to be working on a lot of sporty people, big quadriceps, or just larger areas to cover. Okay, so we'll complete there. Oh yeah, just if you want to go a little bit deeper, oh yeah, you can just rake through the muscle a little bit. And then if you want to do a little bit more specific, either thumb and thumb, find some places, pressure points, or check in with your person. They'll usually let you know, or the breath. Again, breath, breathe in. How's that feeling through there? Good. Juicy?
Maybe I'm not sensitive towards the knee, but yeah.
Yeah. It feels like you're a bit more in there. Yeah, yeah. Yeah. Okay, and then as I mentioned on the other leg, if you wanted to use the forearms, it's another way to cover the whole thigh. Save your hands. It's a few different, you do one at a time or both of them together. So that's a slightly angle. So I'm covering the muscle, or one at a time. Okay, and then I'll finish that up. Three effleurages.